Hello, my name is Henry George. I will be taking you through a very short demo from the outpatient flow to inpatient. I will be very fast. I may not be able to explain everything. So I will just go from outpatient to inpatient, covering the flow and with some short explanations. Insta HMS as a browser-based software, as you can see here, this is locally installed on the LAN here, and this is the local IP address. This is the hospital name, my username, and my password. So I will just click on login. So this is the my homepage. As you can see, patients for consultation. No patient here waiting from this date. So from the menu here, this quickly the modules, the outpatient flow, inpatient flow, the search, billing, accounting integration interface, medical record registration, payments, patients, services, insurance module, a radiology module, laboratory module, procurement that has to do with store management, then dialysis, sales and issue, we have a prescription list for the pharmacies, then maintenance and contracts, surgeries and procedures, pre-authorization, advanced packages, store management. We have multiple stores transferring from one store to the other. Then scheduler, where you book appointments, doctors availability and all of that. Then the dietary, then the feedback module. Other modules are also not activated on this schema, but it has more other modules. Then here are the reports. You can build any kind of report. For example, billing report, you can see there's a builder here. You can build almost anything you want, how you want to arrange it, how you want to sort it by gender, by age group, whatever it is, you can build any kind of reports. You can see the store report, procurement report, consultation report, diagnosis, so many reports here. So I don't want to take so much time on this. I will just come to the registration screen here. I'll quickly register a patient. So I can search out a patient here and create a visit for that patient. You can see you can search by name, phone number, or medical record number. That is searching from the database an existing patient. Then you can now create a visit before doctor can see the patient. However, I'm going to add a new patient. The patient is brand new to the hospital, so I will just quickly start from here. You can add the patient picture. You can snap, capture, or if camera is attached to the computer, or you can just attach from here. Attach an existing. So these are the patient information. So I will just quickly register the patient. Next of kin information, then the patient category. Just select everyone here. Then the email address is mandatory. I will just use this. So I am registering this patient for the first time. Then the patient is going to see the general, GOPD doctor. Then let's say example doctor, we'll just take this doctor. Then the consultation type is here. Then there is the consultation charges is here, and so on. So I am raising this patient as a bill now patient, which means patient must make payment before consultation. So I will just register quickly. So this system will send a text message automatically to the patient, as well as email to the patient. As you can see now, patient with MRO number added successfully to the system, Mr. Sylvester. As you can see the mail here received, and you can see the short message here. Welcome to Soso Hospital. Your medical record number is this, and as well, text message also can be sent automatically. So notice on the registration screen here, system has automatically created this visit. As you can see the visit ID, OP means outpatient 2772228, and the date and time of the visit. So quickly, I will come to the billing screen here where the patient will make payments. As a cashier, I am collecting the bill. System automatically generate the bill. You can see the bill number, this bill now, the date and time. and then there's some visit information up here for the same patient, and you can see the bill number here. Then the registration charges is 5,000. Then the consultation is 31,000, as you can see. And this is the net amount. If there is anything like discount, all of those will happen here. And patient due is 36,000, of course. So I'll be collecting this money by cash. I'll quickly pay and close this bill. So once I pay and close, a receipt will pop up automatically. So you can print, it can be a receipt with header, signature will be here, or the small POS printer, X printer, where you can, when they use in the shopping mall. So you can have all of those printer sizes here. So I can just print the bill with header. Let's see how it looks. Yeah, something like this. The header will be like this. Then you can print and give to the patient. Next, after payment, the patient of course will go to the nurses for triage. If they do triage, they can add triage. If not, they can take only vitals, where you see vitals will come here. So I'll just add a new assessment where you just add only vitals. Okay, I'll add the vitals here. So I can say maybe this one 25 to 5. As you can see, vital entered by the username. Also, remark can also be there. Even it can also have a reference range. So you can see the BMI is calculated here automatically. You can see the BMI here automatically after inputting the other necessary fields. So I'm done adding. I can add another vitals too if there is any need, and so on. So I'll just save this vital. Let me just save and close it. Then doctor will consult the patient. So coming here now, doctor will consult. Of course, this is a consultation template. There can be many other templates depending on the doctor's wants. I can say chief complaint is body pain, and add more complaints. And there are symptoms here too. Symptoms database can probably come there. And you can see the vitals taken by the nurse. You can see here and the name of the nurse that took the vitals. Then consultation notes can go here. The family history can go here, which remains permanent, and so on. Then the diagnosis, previous diagnosis will come here. Then the diagnosis, I can say I am diagnosing this. That's the primary diagnosis, as you can see. Then the next one will be secondary diagnosis. So automatically, I just add and close. Then nurses report can come here, especially when they are doing the triage. It should be here, as well as management. So currently I am prescribing investigations, which is FBC, wider, take this wider, MP or CBC, something like this. Can give, I can as well refer the doctor to another doctor or department, maybe cardiology and so on, and give instruction here. So just add and close. So this is what we have here. The other instruction can come here. Follow up, you can add some follow up details. If there's no need, you remove that. So I will just save this consultation. So now doctor has done the initial consultation. So patient will go to the cashier to make payments for the laboratories. So I will come here as a cashier will have to come here and select the visit and order for these services. You can see system is telling the cashier pending prescription exists. Patient has pending prescription to be ordered. So I'll click here to order this prescription. So now doctor has prescribed, is already in the EMR. Then making the bill now for patient to pay. You at that point that's where you can ask the patient, okay, doctor prescribed this and that. Are you ready to do it now? You have to pay for so. Whichever the patient is not ready to do now, you can just uncheck and only order for the one the patient can do now. So let me just select all and add. You can see this is the amount of each of these items here. You can see laboratory, and laboratory. System will generate a new bill here. And I can as well tell the patient at this point, before I hit save, that okay, you are paying so amount for these 3 tests. Patient say, okay, go ahead. Then I can now generate the bill by saving. So I can also prescribe other services. I'll come back to the doctor screen. I can prescribe other services like maybe wound dressing. I can say quantity 3 days wound dressing. I can just add and close and save. So notice coming back here, system will also tell you there are pending prescriptions, and to order the prescription, you can see the 3 wound dressing ordered by the doctor. So patient have to pay for it. You can see it's going into this bill that is already open. It's not creating a new bill here. It's just everything will just be on a single bill. So this is a new amount. So I'll just save. I'll click on this bill link to take me to the bill, or I'll just come back here. As you can see, 52. Or come back to the billing tab here and select the 52 bill. Bill automatically generated. So at this point, you can collect the payment from the patient. So I'm going to do wire transfer. I will do the patient, let me say the patient transfer 200,000. So the patient transfer 200,000. Then I'll add another payment mode that, okay, patient is paying with POS debit card the remaining amount. So there are some ref information here, card holder, and so on. I can give narration here. So I can just pay and close. You can see the items here, full blood counts, this Widal, then adrenaline, malaria MP here, then this other services. So I will just pay and close. Bank is required. Okay, yeah, for the wire transfer. So which bank is he paying from or to? POS, money point. Okay. So system automatically, of course, will generate 2 receipts because patient has just paid for 2 different things. So these are the receipts. For these receipts, you can see the narration there. And for this other receipt also, you can see the narration there. So from here, patient will go to the laboratory. To the laboratory, will collect sample. Laboratory don't have access to this screen, but I'm just doing everything together. So I'll just click on collect sample here. I have the link here. If I have access to collect sample, so I click on collect sample here. Although normally the laboratory can come to this place, laboratory pending samples. So you see the 3 samples pending. So you just click collect sample. I'll be collecting sample for these 3 tests. You can see I'm collecting blood for FBC and so on. So quickly collect this sample like this and print the barcode. System automatically print the barcode. So this barcode will be printed and stick to the tube sample collection container. So in an automated system, which our system is capable, the system will scan this barcode, the analyzer or the laboratory machine will scan this barcode and check the system, the software, to see which test and which test is attached to this barcode. Then this is full block count here attached to this one. Then this one will have others. Then this one will have the outside lab test. So the machine will check the software to see which test is attached to this barcode. Then it will conduct it and send the result back into the system. So on a normal typical settings, what you'll be seeing is like this. So I will come back here and say, for example, full block count. So system will automatically paste the results here. So, but let me input it manually. So here we'll be having 5. Look at the severity will change automatically. Severity will change automatically as normal. Then here I put 70. It's normal. I put 45. It's abnormal high to color code it, and so on. So the system will paste the result for all these test labels on this box automatically. That's the machine analyzer through the laboratory information system. Will send it automatically here. So you as a lab scientist just go through it and validate it. And of course, I'll validate. I'll select the conducting doctor and save. So let me save on print and see how it comes here. It will come like this. So I have saved. Then when I'm very sure, like maybe the HOD will go through it and of course do the final approval of this result, sign off. So I'll sign off and print and see how to just come like this. See laboratory, and these are the values. You can see the abnormal ones come in bold, and of course you will see this letter L means low and H means high. You can customize this thing, color code or anything depending on how you want it. This can be color coded actually, however you want it, red, green, blue, whatever. However you want it, it can be color coded depending on the hospital's requirements. So this test is out. So I will go back to the and manage other tests. Wider reaction, I will conduct it together so that it should be on a single print. So for the Tixmer 3 plus, you can take the severity like this, as well as the widal, as you can see the MP here, then the widal here, so you can do multiple texts on a single print. So I'll just click on this template. It should give me something like this. So I can adjust any of these where necessary. Let me just put something. I will save. I'm done. I will save. I'll validate all. And of course, select the conducting doctor. Save and print. Let's see how it will come out. So I will sign off the reports. Click and sign off reports. So it will come just something like this. So remember again, this can be customized to suit your whatever need. And that is it for the laboratory. So coming to wound dressing like services, you can see the services pending. Yeah, pending services list here. You will see where the services are pending. You can actually conduct those services. So you can see the patient service here. The patient picture is also here. You can add your service notes here. So I can save and print. Conducted by. So the service note can also come up like this, and that is that. So the patient will go back to the doctor for review. So of course, so from the doctor screen here, doctor has access to direct EMR view of this patient. EMR view involve all medical record of the patient, both the past consultation as well as laboratory report and every other report and document. So I'll click on this EMR view. This screen will pop automatically. So expanding this laboratory reports here, you will see the laboratory reports by date. See the reports here. This is the wider reaction and this is the result, as well as the MP, and the full block count also result is here. So as well as other past consultations will show here. The latest will be at the top by date. So once you click here, you see the consultation. Today's consultation, you can see the details here. That is it for the EMR. Also, system can automatically connect to PACS here too. You can see the PACS repository. So if there are imaging system integrated, of course, system will automatically link the patient to ESM record, but there are no record, no PACS here yet. But that is the PACS. And also from the consultation screen here, you will see the PACS viewer here. System will take you straight to the PACS where you view that particular patient image. But this patient has not conducted any radiology studies such as MRI, CT, X-ray, and so on. So I will just do prescription now. So after viewing the laboratory report, I will prescribe for the patient. So first of all, I'll take a 10-meter. Okay, maybe I'll take something like this. For example, you will see the system will show you the generic name, the brand name, the quantity left in stock, in pharmacy stock. You can see showing in stock, and the price will also show there For example, look at this. This is out of stock. So system will give you all this information and you will see the quantity left. So let me just select this one. Oral, I'll give frequency maybe PD for duration of 3 days. So the quantity will go as one. So I can give instruction here just like that. I will add. You can add this as favorite so that next time you don't need to type all this thing. You will just pick this drug and all these things are already there automatically. So let me just add. I pick another drug such as paracetamol. Notice that is comes in pack, so everything goes at one. So everything goes as one. So I will prescribe this paracetamol. Also, I will select the by one, that's the counting. So paracetamol 500 mg by one. So you see the 16 tab here, you see the by one here, the counting. So this is paracetamol counting. Notice that the quantity here there's nothing there until you select every other field. So I am giving 2 tablets. I see 2 tablets. BD Federation. If I put BD, or let me say, sorry, TDS, then duration, if I put 1 day here, notice the quantity will come. So giving 2 per day and only 1 day. So of course, morning, afternoon, and night, you can see quantity is 6. So if I make it 5 days here, which is the usual calculation, you see the quantity comes as 30. So this is the quantity that the pharmacy will dispense from their end. So I will just add this details here. So that is it. I add as well as vitamin, can be any other thing, maybe supplements. So system will tell you if it's a controlled drug, you will see the system will pop out that is a controlled drug. Probably it's a supplement and discount is not allowed or whatever it is. You can control some particular set of drug depending on the settings. So I'll just add this. I'll add and close. So I've prescribed drugs now. I'll save and close this consultation. I'm done with the patient. So the patient is going to the pharmacy to collect the medication and go home. So now this patient will go straight to the pharmacy. So pharmacy will use this module, which is prescription list. We use this prescription list from here. I'm seeing everything because I'm using the admin account. So don't forget. So prescription list here. They will see patients waiting to collect their drugs. So this patient, you can see the patient details. The prescription status is not dispensed yet. So I'll click. I'll probably view prescription print. View just to see what doctor prescribed. Okay, this, that. Okay. So you can just come back then make the sales. So from here I will raise the bill. So same telling me that okay, this item is not in stock. Okay, you can see okay, no discount item. See this item, the control type, no discount. This is normal. So this is what we have. So system will give you the drug, the item name. You can see the control type, the batch number. So the system will give you, will dispatch from the sooner to expire batch. So this is going from this batch and this is the quantity in this batch. You can see, but this is the same quantity we are selling only 30 and this is a price. So from prescription list here of select sales, okay, system will warn you if an item is soon to expire. System will tell you that okay, this has even expired past expiry. So depend on what you want, you can actually allow sales expired item to be sold. So this is the item here. You can see the details and the batch and the price. So you can raise the bill. So I'm going to raise the bill now. The bill is raised. This is the bill, cash bill, and then this is the prescription print. So going back to the cashier will come to open bill list. The cashier will see the bills here, and of course this is the bill, the BPB bill pharmacy. We just open the bill and collect the payment from the patient. Then the patient can go back to the pharmacy with the payment slip. then collect his or her drugs form. So I'm going to make this payment as cash. You can see the sales bill here. Collect this as cash, and yeah, and that is it. So that is the outpatient flow. Okay, now so after the outpatient consultation, the doctor decide to hospitalize this patient, to admit this patient. So the doctor will raise an admission request. So I will add new admission request here. Admission date today. I want the patient to be admitted today, and admitted date that this is optional. Then you can add comments here. Comments can go here. So this is the diagnosis. Of course, it carried the diagnosis from the outpatient consultation. So this is a request actually to admit the patient. So I can add some investigation. So I can add some admission order here, such as X-ray, maybe CT also, maybe brain CT once. I add CBC, malaria. Okay, I want it to be repeated at intervals of one daily. Happen 3 times. FBC, I might decide it should keep happening every day, one daily till discontinue, not number of occurrence anymore, and so on. So that is the prescription panel. I will save this admission request. Then of course the admission office or the cashier or whoever in charge admitting patient will now have to admit this patient officially, majorly by the billing office. So they will come from admission request screen here. So they will see the patient's admission request pending on green. So they can click and convert the patient to IP. Convert to IP. So it will bring the inpatient registration screen. So that's what we have here. Okay, saying there's an out visit, active outpatient visit. We can close it or leave it there or leave it open. So this is the screen. We don't really need to do much here. Payment information, of course, bill later. The inpatient bill will have to be bill later, and the rate plan is general here. Admitting department, admitting doctor, then bed type. So we are taking the patient to, let's say, VIP bed, and we have, yeah, we have 4 VIP rooms ward. Then we have here VIP 1 and VIP 2. Let me see, VIP, we have one here. Okay, let's take admit the patient in this VIP bed. So this is it. Then I will register this visit. So this is the inpatient registration source. As you can see, the visit ID has changed to IP. So you can add some IP form here if there is any need. You might add some form here, maybe some admission information. If so, this will come like this. You can as well generate it. Okay, we can print the auto-generated. Okay, then at this point we can actually proceed to billing. We can print registration card. Yeah, it should just come something like this. You can actually print registration card from here after registering the patient. Not doing that, you can print barcode so that next time we can just scan registration card number. You just scan it to pop up. We print existing one, which is this, or we can create one. Generate sample barcode. Then we can upload documents then back to registration. So normally, by registering the inpatient visit, you can just proceed to billing, collect the advance payment, which is admission deposit. So I will collect the, you can see system has already charged for the first day bed auto charged. But if the day is less than whatever you set on your preferences, this amount will withdraw automatically. So let me collect advance payment, as you can see here. So maybe for this particular admission, We are collecting 400,000, and that is it. We are collecting cash and save. So notice the patient due will adjust. This is the receipt for the advance payment. Patient due was already 400. Oh, okay. So we can collect advance payment of let's say 800. So let me add another 400,000 and save. So notice the patient due now is in negative. So as the patient will be taking services, system will be deducting. Notice what happened once I add this item now. See, it's deducted automatically. Okay, why is this 3? See, it should be deducting the amount patient has left automatically gradually until the patient finish exhausting the amount, then it will go to positive. So let me just remove all this. So coming to the inpatient, normal thing will happen. They will take their vitals either hourly or whatever it is. The vitals can be inputted and so on. To see the way the vitals will come. So the vitals will come like this. The latest reading will be here. Okay, so it should be shifting to this side. That is the vital reading. Notes. Anybody can add notes because doctor's notes, nurses notes. The first note, that is the admission note. So nurses notes can go here. They can be we can create unlimited number of notes here depending on what they want to add, and they can add all these notes. The doctor can as well also add their own notes, doctor's notes, and maybe doctor's visit. It could be anything. Select template. Then on behalf of a particular doctor, then it can as well be billed. Can as well bill this particular visit. Maybe this particular visit and add your notes here. Let's save. So that is the notes. People will be adding notes, and you will see the name of the person who added the note and the time and so on. You can read through the notes. This is the inpatient. This is the IPEMR. IPEMR, yeah. And this is the physician order here. You can see some tests that were done from the outpatient. Some of them were also carried into inpatient here. Not to be reconducted, but just for the record. So I can add prescription here. So for example, this is the prescription part, how it works. So let's say doctor is prescribing paracetamol 100 500 mg tab. So the doctor's instruction is should go PRN, regular start, urgent, all those things are there. Oral, okay. I want this to happen at 2 tablets. As usual, because it's 500 mg. I want it to repeat at intervals of 2 hours. Intervals of 2 hours, that's 2 hourly, starting from this date and time, and it should be happening till discontinue. I want it that way. Then I can give other instructions here too. So I'll add this. Let me add another thing, vitamin. Okay, this is stock. You see the stock level, which is a very nice thing. And like I want it three hourly, starting from this date, either to discontinue or it should end on a particular date, or it should happen for, okay, let me say 1 hourly. It should happen for 4 times. So the thing will discontinue. You understand? So you can prescribe the inpatient. This is the inpatient prescription panel here. And you can as well, of course, prescribe investigation. So I can say do wound, okay, let me say FBC, every, as a start, should be once, or every every 2 hours, and it should happen 7 times, or let's say 3 times, and so on. Yeah, to remind you that full blood count was conducted during outpatient visit. So do you want to also add it? You can as well proceed. So services is there, consultation, you can request for other doctor to come and see the patient. Then service set. Service set is like having other sets, having sets of diagnosis and diagnostic tests and other things, other procedures in a pack. So you don't need to type all this in. For example, maybe a particular set of diagnosis that you use to treat typhoid or malaria. So you don't need to be typing them one after the other. It will just it's already preset. So once you type it, or that will come, you just add straight. So let me close this. I've prescribed this as a doctor and add my note. So now the diagnosis is here. Yeah, the problem list is here. Okay, then the EMR, the MAR, that is the medication charts, medication administration record. So now doctor prescribed these two drugs. They are pending for setup. You understand? So, but first of all, the nurse have to go and collect the drug from the pharmacy. The nurse will have to raise an indent. So you see patient indent here, patient indent. So the system will tell me there are prescription for this patient, of course, as doctor prescribed in the inpatient. So these are the two drugs here. So I will now request and put the quantity I am collecting from the pharmacy. So maybe for this one I'm collecting 10, and for this one I'm collecting 8. Okay. Then I'm requesting from this store, from the pharmacy store, and I'll finalize the indent. Of course, this is date and time. The priority, normal, urgent, you can do whatever you want there, then save. So now I have saved an indent, that is a request to collect drug for this particular patient. So the pharmacy will see it once I get to the pharmacy counter to collect the drug. So the pharmacy will check from their indent. This patient is waiting to collect. They will see the indent here for the patient name, the ward, and the room number. All will be here, the date and time. You can see the red flag here is set to be urgent. So I can click, then I have to issue the item. So once I issue the item, automatically it will go to the bill. As I'm giving out the item, the system is being charged directly to the patient bill directly. When no stock available. Oh, really? No stock for this guy. Pharmacy, I will have to come to the indent. So I will check patient indent list, and you see this patient's indent is pending as urgent. So I will just issue the item here. I'm issuing from this store that I must have access to that particular store. So you can see the item name, the batch number, expiry date, and all of that. So it will drop into this bill automatically once I am giving out the items. So I'm giving 8 here, and I'm giving 10 here. Okay, I'll save this automatically build, and now the nurse can now come and set the medication chart. So this is the medication chart. This is details of the prescription. You can see paracetamol every 2 repeats every 2 hours from November 7th till discontinue. That is the instruction by social doctor, and this is the remark. You can see all of that there. So till discontinue. So I will set up the charts. That is according to the instruction. System will suggest your charts, your medication charts. So you can see the instruction said every 2 hours. The system has already plotted from this time every 2 hours. If there's any need, I can shift it. If the time has changed, I can actually shift it to 2 hours, then save. The instruction said to discontinue, so you can see it's infinite. So I'll just add a remark here. So I have charts, I will save and go to the next medication. You can see the next medication say here, repeat every 1 hour. So you can see and it should happen for 4 times. So system has already charted it for us every 1 hour for 4 times. That's 4 good hours. This should happen. So just add a remark here and save. So system has already plotted it for us now. So you can see this is due at this time. That's why it's on blue link. This is due at this time. And of course, I've collected the medication. So I'll just come and click on this link for this drug. I have administered. This is the batch number and I have administered. System will mark it. If there is any other remark, I can add remark here. And let's assume the patient didn't take. You can as well add other remark here. Patient initiated, patient in procedure, patient discharged, asked to be discontinued, and so on. Oh, the next hour for this one is already due again because the instruction said every 1 hour. So I haven't recorded this one. So let me record this. Let me just put it. Okay, yeah, it's just 10 o'clock. Yeah, just 10 o'clock. So let me say I give this one. Okay. Can add another remark here. As well, this one. Also time. So I have charted this now. You can see at this time, this is done. This is done. This was also due by this time. It's also done. This drug is 2 hourly, but this is 1 hourly. 4 times only. The same as charted 4 times, but this is infinite till discontinue. So now that is for the drug administration. The record is already taken. We can actually take a look at the visit EMR. That is for this particular inpatient admission electronic medical record. This is the doctor's order here. You see the doctor's order here, the EMR, which has to do with diagnosis. Then the notes. See the notes taken here. All the notes, doctor note, nurse's note will be here. Then vital charts will also come here for this particular visit ID. Understand? Then medication chart, of course, you can see when it was given done, just the medication chart will come up nicely like this. So for other things such as laboratories and radiology, so you will come to patient ward activity. This is where you monitor other activities going on that patient. For this checks x-ray, the instruction was number of occurrence once. It should happen only one. So I have to first of all order for this item. Once I order for it, then to go to the radiology information system or PACS if that is also integrated into the system. I say if I order for this one, I say for the CT also the same thing. I have to order for it. It's still on progress. MP, I have to order for it. Next item, full blood count. I have to order for it. Next. Okay, full blood count was set to happen 3 times. So okay, so I will save this. So with this now, it's already pending at the sample collection screen, which we can actually do from here. Let me collect sample. You can see them here. They're already ordered. You can actually collect the sample as usual, collect and print. Then they'll do the test, investigation, and put the result just like that. I can come back to patient ward activity also. You see, because this time this is done, then the nurse at this point, because this is marked to be done once, at this point the nurse can just mark it as done. Then the next item, this is also done. If the CT is done, next item, this is marked to be done 3 times as a CBC, so I'll mark this one as done. Next, this one also, it has been ordered, mark it as done, then okay. So you can see the CBC is remaining because the instruction was that it has to be done 3 times. So I will do the second one. I'll order it for the second one. This is okay. This is to be discontinued. The full block count is to be discontinued. This is the second time. Then the CBC, because the instructions said it should happen 3 times. So let's say we're ordering it for the third time now. I have to done it. Then it has happened. This is the, yeah. So this is the third time now. I have to done it. It's done. Then I save. You can see it has disappeared. So it has completed the 3 times occurrence as doctor prescribed. So these ones can also as well continue the same thing, and doctor might decide, okay, looking at the patient is getting better, can actually come and discontinue those items here. For example, doctor can come here and discontinue this prescription. You understand? And proceed and save. They might have done it 2 or 3 times. So clicking on this now, notice that the full blood count has disappeared because it has been discontinued. You understand? Even this other one can also be discontinued here or cancelled because instructions said to discontinue. So I can just, okay, sorry, I can discontinue this full blood count from here because, oh yeah, system said till doctor discontinue. So you have to come and discontinue it as the physician. Then save. Come back to the patient ward activity. Notice nothing is pending for the patient ward activity. So every other thing they prescribe will just be coming on that patient ward activity and so on. Same thing happens to the medication chart. So you can see the next hour will be due until I can come here and stop it, maybe by the nurse, or doctor can do his thing from the physician order here and discontinue these drugs. So for example, I want to discontinue this paracetamol because the instruction says to discontinue. So I can just come here and discontinue the drug and save. Then notice on the medication administration record, that's it, medication charts, that drug will disappear, paracetamol, because it has been discontinued. You can actually see all medications. You can see this one has been stopped. You can see all the details. It has already been stopped. It was done once. You see the details here. Administered by who, what time. You see the plan time for this medication. You see the plan time, you see the actual time it was administered, then administered by who, then you see the comments, just like that. So, and I can actually stop this here, maybe by the nurse, stopping this on behalf of Dr. So ordered to be just like that. So this also has been discontinued. The drugs that are remaining, we can actually return it, then the system will credit the patients back. Let's look at the bill. Let's look at the bill. See, the bill is growing. We have done so many things. The bill is growing. You can see. See those things we ordered. See the drugs we took. So now we want to discharge this patient. Doctor can give his or her notes from discharge here. So the doctor can initiate his or her discharge. You understand? So the doctor is initiating discharge. Discharge date today. Remark. Save this. So you can see the chat has been initiated by so time, and you see the name of the doctor, the name of the user that initiated the discharge. Really? Mm-hmm. Mm. Now coming to clinical discharge. Clinical discharge. So that's where the nurses do their clinical discharge. Patient is done taking his drugs and so on. So at this point, I think it is right to actually now probably return the indents, the medications that are left back to the pharmacy. So I will raise a return indent here. Patient return indents. So I'm returning to this store. I'm returning yeah, this item quantity 10. So maybe I'm returning maybe 5 paracetamol. I'll be returning 2. I'll save. Then, of course, going back to the pharmacy, the pharmacist will take those drugs from the nurse who is returning it, or orderly, of course, and return. So the returns will be accepted, and of course, this is the items, this is the quantity, correct. So acknowledge, yes, you take it back to the pharmacy. So the inventory will go up by so number, just like that. And then this is the print is here, although sometimes it can pop up automatically. So coming back here now, I've returned the items, and coming back to discharge now, that's a nurse. So you can see pending ordered activity 6. This is what these activities. Okay, it will monitor if they are done or not, but actually that's the laboratory and radiology. Then the what activity pending is 0, ordered activity is 6. So indent that is pending is 0, no open indent like request to collect anything. So they can at this point do their clinical discharge. Yes, save. So clinical discharge has been done. You can see it has marked there. So notice physical discharge, financial discharge have to happen first before physical discharge can happen. Notice this button can never be clicked. So you can't do the physical discharge stage until the finance team have to conclude their work. So this financial discharge will activate physical discharge. Report finalized, that is discharge report, or transfer reports, any of those can happen, but it doesn't block physical discharge. So we will go and finalize the bed. So let me view the bed details here for this patient. So this is the cashier doing this. So the cashier edits this. Okay, VIP ward, which is doctor, update charges and see what we have. Charges has been updated. Okay, I can actually finalize the bed. So at this point, I'll finalize the bed. So once the bed is finalized, I'll come back to the billing, and of course, the patient is clearing his or her bill. I will close the bill. So the patient is owing you see the items returned. These items, this minus minus, those are the items returned, and these are the ones consumed. So this is the total amount. This is the net amount. Patient already deposited 800,000. So we're going to be collecting this remaining amount from the patient. You can see patient due. So we collect this settlement. That's cash. Then I'm closing the bill. So at this point, it automatically mark this okay to discharge. So this is okay to discharge is what will offset this discharge screen, set this financial discharge. So I'm going to save the payment now, of course, and receipt will come up. So looking at this discharge screen, notice that financial discharge has happened. Notice that because of that, now physical discharge is here. So discharge type can be DAMA, discontinued, can be any of these. So let's say it's a normal discharge, you can give your comment here. And if it's dead also, you can also put it there. So let me just give the comment. Cannot do physical discharge, then the bed will be freed. You can see physical discharge is marked now. So that is the outpatient and inpatient flow. So I can check some reports, such as some financial reports. So let me just say under billing here, let me see my day book. Let me see how much I've made for a particular date range, a particular billing counter. But let me see all billing counter, all usernames, all users, and all payment mode also. Let me generate PDF to see how it looks. So you can see the collection report. So this is so counter. So cash, you can see cash here. Check for this user collected this social amount of cash and social amount of check, and POS, some amount of wire transfer. You can see the total down here. Then the grand total comes here. Then user collection details. You see the details, the receipt number, the patient name, the amount, the receipt bill number, the receipt number, and so on. The details here. And total collected by Henry is this amount. Then if there are other users too, it will show if you run report based on user or per be it per user per counter age range. You can as well run those reports. So there are so many other things we didn't cover, such as radiology, but it's almost the same thing. Inventory, workflow, booking. The system covers everything that happens in the hospital, but we cannot cover that in this demo because, of course, it will take almost forever to cover everything in the system. The software is quite robust, very robust and comprehensive. It is designed to cover almost everything you need to do in the hospital. So thank you so